Good afternoon. Since Friday, May the 15th, we have seen an 11% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 4,002 reported cases, 406 people hospitalized with COVID-19, and 202 deaths. That is 202 families in our city grieving, and I grieve with them over the loss of their loved ones. I'm up here at least 3 times a week to ensure our residents have the most up-to-date, accurate information, so they, in turn, can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise right here in the city of Baltimore. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. Last week, we launched mobile testing initiative with 3 sites across the city. Last week, I also officially extended the local stay-at-home order for Baltimore City. This means that all residents are required to remain at home unless they have to go out for an essential work-related job or task. I keep hearing there was confusion around my announcement last week, so let me be very clear. Baltimore is still under a stay-at-home order. There has been no change in business being able to reopen and no lifting of restrictions on non-essential activities. Today, Maryland health officials announced 1,784 new cases, a single-day high for the state, and 60 more deaths. The city recorded 113 new cases and 9 deaths, still showing percentage increases in both areas. And the positivity rate for tests is holding steady in the city at 20%. Baltimore City reopening must and will be guided by the data and science. That is the only way I can responsibly tell residents that it is safe for them to return to normal activities even while maintaining social distancing. This decision has been made after close consultation with our public health experts. Baltimore City is simply not in a position to safely reopen at this time. To get there, we must significantly increase testing capacity in order to meet guidelines established by public health experts. Please, believe me, I would love nothing more than to be able to tell our residents that it is safe to resume businesses and other activities. But we're not there, and I would be negligent in doing so. First, I want to thank Governor Hogan for committing up to 500 tests per week to Baltimore City. We're looking forward to receiving these tests. Again, based on Baltimore City's population, World Health Organization guidance would indicate roughly 2,700 to 2,800 tests should be completed per day. We're not there yet. In the most recent full cycle of testing, the average number of tests conducted per day was 571. So as you can see, even with this new commitment from the governor, there's a large disparity between where we are currently and where the CDC guidance is recommended we be at to reopen safely. I'm hopeful that the state will continue to step up and help with our testing capacity. But the simple truth is that right now, today, we need more tests to safely reopen. We also need to see a sustained decrease in cases and death. So far, the number of cases and deaths have continued to increase. We cannot lift the stay-at-home order until these increases stop. Then add to the fact that 83% of the city hospital ICU beds are currently in use, a number that remains stubbornly high. All of the data just reinforce my position that Baltimore City is not ready to reopen yet. Today, I'm excited to announce that Baltimore City is taking steps to increase our testing capacity on our own. The Baltimore City Health Department has gotten our lab certification so that we can begin to process our own tests and expedite this whole process. And while we are here to announce expansion to our testing capabilities, our average daily testing rate is not even a quarter of the approximately 2,700 tests per day that experts recommend. I know I probably sound like a broken record because I keep saying the same message every week, but it's that important. We need everyone to stay home unless you need to go out for essential reasons. If you must go out for an essential reason, everyone should be wearing a face covering. This covering isn't for you. It is to protect everyone you come into contact with. It represents that you care about your fellow residents and their well-being. And I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. You are the reason we have made progress flattening the curve, but we need everyone to stay focused and vigilant as restrictions become relaxed. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can actually save lives. Now I will ask Baltimore City Health Commissioner Letitia Zavasa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership during the pandemic. This past weekend, we saw pictures on social media and heard reports of massive gatherings around the city on the day Governor Hogan announced that the rest of the state was moving to a safer at-home model. Let me take a moment to remind residents that Baltimore City remains under a stay-at-home order. Locally, we have yet to see the levels of testing availability and decreases in new COVID-19 cases necessary to safely consider reopening non-essential businesses and lifting the stay-at-home order. Massive gatherings in the absence of a vaccine with disregard for social distancing and face cloth coverings is one of the most effective ways to spread disease, strain our hospital resources, and dramatically increase our case counts. For the safety of our city residents, especially our more vulnerable population, I urge all residents to continue to stay at home unless for an essential reason. As Mayor Young noted, today I am pleased to announce that the Baltimore City Health Department has entered into a new partnership with lab vendor Hologic. This will dramatically increase our testing capacity for COVID-19 right here in Baltimore City. With this partnership, the Baltimore City Health Department will soon be able to analyze COVID-19 test kits in our own labs. In addition, we have secured 18,000 COVID-19 test kits for Baltimore City residents. These tests will be deployed at our community sites across the city and will serve as a way to expand our mobile testing capacity to more neighborhoods. In addition to expanding our testing capacity, contact tracing remains a vital component to our fight against COVID-19. Our contact tracing teams still need to see full participation from Baltimore City residents who have been contacted. As a reminder, contact tracing is the Baltimore City Health Department's way to inform residents that they have been exposed to coronavirus, as well as to determine who that resident may have come in contact with while they were able to spread disease. On these calls, we also provide critical information about community resources, how to self-isolate, and how to limit further spread of disease to your family, friends, and loved ones. Our team is still reporting that some residents are choosing not to answer the call or refusing to provide all the details that they're being asked. Please answer the phone when you get the contact tracing calls. Please answer the questions honestly and be sure to provide information that the contact tracers are asking for. These calls are confidential, and we would never ask residents for personal information like social security number, credit card information, or immigration status. We will leave a voicemail, so please, if you screen your calls, check your voicemail and call us back. Again, I cannot stress enough, contact tracing remains the best tool the health department has in the absence of a vaccine to reduce the spread of disease, and we cannot be successful unless residents are taking these calls seriously. It is vital that every single resident continues to follow the stay-at-home order as outlined by Mayor Young and stays at home unless for an essential reason. It is necessary that every resident continue to practice social distancing, continue wearing face coverings when in public settings, and provide the necessary information to our contact tracers if you're contacted. All of us working together is what allows for the city to safely move forward and eventually lift our stay-at-home order. Thank you.
Thank you, Dr. Zavasa. And now we'll take a few questions.
Mayor Young, do you have any thoughts on expanding testing to asymptomatic people, which the state announced today? Will that help the city get to a place where we're ready to reopen?
We want to test everybody. I'll let the health commissioner come. She is charged with doing that type of thing. She can answer that.
So as Mayor Young noted, we want to expand our testing capacity to be able to test anyone who's symptomatic or anyone who's deemed appropriate for testing. That includes asymptomatic folks who maybe have had exposures or who work on the front lines.
Mayor Young, so I know you talk about how important social distancing is. I know over the weekend there was an issue, maybe I think in Fells Point, there were a lot of people outside. As the weather gets warmer, what's your message to people, that it's still important to stay inside and social distance?
It's still important to do that. Until our health professionals tell us otherwise, the stay-at-home order is still in effect. And I know what happened down in Fells Point, and to the credit of our police department, they went down there and peacefully dispersed the crowd. And that's what we want. We don't want to cause any commotion or disruption. We were asking people nicely and peacefully to please respect the social distancing and leave.
Do you have any thoughts on any restaurants or businesses that seem to be kind of wanting to move forward and open up despite your ruling? Will there be any additional enforcement, especially over the Memorial Day weekend?
Well, the governor's order has not extended anything to restaurants. And it's still a stay home order for me as mayor. And anybody that violates that is breaking the law.
Anything else? Carl?
My last question is that we understand that there are discussions being held at different levels about Major League Baseball returning. Do you have any thoughts on baseball being played in Baltimore this summer, whether there are fans there or not?
Well, I'm hoping that we have really got out of the COVID-19 epidemic, and I'm hoping that we can have baseball games and concerts again. But right now, we're following the direction of our health professionals and data to drive all of that.